The blood vessels are the conduits of the circulatory system, so let's take a look at their structure. There are three types of blood vessels. Arteries take blood away from the heart. They're going to branch into smaller and smaller structures called arterioles. The arterioles will eventually feed into the capillaries. The capillaries are the site of exchange between the blood and the tissues. Capillaries come together to form venules. Venules continue to come together to form veins. Veins return blood to the heart. The blood vessel walls are composed of different layers. The central opening of the blood vessel, where the blood is called the lumen. The innermost layer is the tunica intima, or the endothelium. This is a simple squamous epithelium. Its function is to reduce the friction between the blood and the blood vessel wall. The tunica media is the smooth muscle layer. It is composed of circularly arranged smooth muscle. Because this muscle can contract or relax, the tunica media can display vasoconstriction, or narrowing of the lumen, or vasodilation, widening of the lumen. The tunica externa, or tunica adventitia, is connective tissue. It's loosely woven collagen that helps protect the blood vessel and also helps anchor it to surrounding structures. Arteries have all three tunics, and they have the thickest tunica media. The capillary is composed only of a tunica intima. The veins also have all three tunics, but they have a very thin tunica media. If we look at the blood vessels, we have the arteries, the veins, and the capillaries. The outermost layer, the tunica externa, is the connective tissue. Notice that the tunica media is much thicker on the artery than on the vein. And here the capillaries only have a tunica intima. The arteries have a tunica intima, as do the veins. The arteries have thick muscular walls because they have to withstand pressure. Capillaries only have that single layer because diffusion has to occur across the capillary layer. This allows for easier exchange between the blood and the tissues. The veins can have thinner walls because they experience less pressure. Their lumens are larger because they're not as tightly held by the weaker muscles. They also have valves to prevent backflow. In this cross section of tissue, here we see an artery. Notice the thick tunica media. Here's the vein with the thinner tunica media. Because of the thick muscle wall, arteries tend to stay open even without blood in them, so this is rounder, but the vein tends to collapse and give you more of an oval shape. Here is another small artery, the thick tunica media, more rounded, and here the veins, not quite as round a shape and much thinner tunica media.